hormone issues, type 2 diabetes, thyroid, all kinds of things fall under that endocrinology scope. And my friend, Dr. Kelsey Dexter, is going to come on and clear up some things that she has came in practice and give us some really cool things that no other endocrinologist is going to tell you. All right, Dr. Dexter, Kelsey Dexter, thank you so much for taking the time to visit. It was a pleasure getting to meet you and the family on y'all's way through Arkansas relatively recently. And you've done quite a few interviews with some of my friends, our mutual friends, and as an endocrinologist, you are talking about things that nobody else seems to be kind of in that space. And so wanted to dive in with you on what you were applying, how you were bridging some of these concepts from the allopathic medicine to more of this kind of quantum and circadian fields. And so if you will, let's just dive in and tell us, what it is that you're doing, and then we'll start breaking it down.
Okay. So I am a traditionally trained allopathic Western medicine endocrinologist. And I have had my own journey with health over the past few years that kind of sent me down a rabbit hole of learning about what the body can do for itself. I recognize that, America in particular is hurting when it comes to this burden of chronic disease, chronic metabolic disease. And our world of pharma-driven care is not making an impact on outcomes, and it's not making people feel better and live their most vital life. And so I, have been trying to stay curious through this whole process, learning from other practitioners, patients, thought leaders. And I've really recognized that there are so many other avenues to healing that we are not taught in medical school, right? And the foundational health principles that create vitalism in the human body are not even touched upon in medical school. I think that's really crazy overall. But when you look at the history of medical education and what kind of got us to this space, there has been a lot of censoring and siloing from big interest groups trying to manipulate this system into a profit-driven system, right? So I have always been holistically minded, and whenever I was in training, I really wanted to pursue formal work in integrative care. But back when I was in internal medicine residency, and I was seeing patients in my clinic who were obese, had hypertension, heart disease, chronic pain, and I was just doling out these medicines every week and knew that I wasn't helping them at all. Back in those days, functional medicine wasn't really a thing. Integrative medicine was sort of in its early stages. Dr. Andrew Weil was one of the big thought leaders in the arena at that time, and he had a training program that I was really interested in, but it was an out-of-pocket cost of about $30,000 to be trained. And I was a broke resident with a bunch of student loans, and there was no way that I could actually get into that space at that time. So I thought about what kind of challenges are facing Americans and how I wanted to further my education and what kind of space I wanted to be in. And I decided to study endocrinology, mainly because of the emphasis on metabolism, right? I knew that metabolic health and metabolic disease was one of the big drivers of all these comorbidities that cause morbidity and mortality in the country, right? The things that people most commonly die of, cardiovascular disease, Alzheimer's, cancer, complications of type 2 diabetes, all have this relationship in metabolic disease at the origin. And I studied at University of Colorado in Denver, and they have one of the biggest obesity research centers in the country. I had some really, really great centralized medicine teachers and got a good foundation that way. And whenever I started practicing, I just have always wanted to emphasize diet. Okay. That was when you talk to people about diabetes, you can make a huge impact by the dietary choices you make when it comes to controlling that condition. And I have been big into nutrition and studying nutrition on my own for decades because of that. When I got to a point, sort of full burnout during COVID and being a mom of 2 little babies and like trying to navigate that whole scene, I started having some pretty significant nervous system issues. And my doctor thought that I probably had early multiple sclerosis. And so then, I had already been going down the journey of optimizing my diet, cutting out processed foods, leaning into intentional ketosis to lower inflammation, all these other things. And none of that was helping me substantially. And then I started looking at the data when it comes to sun exposure and incidence of MS in the United States, or worldwide, really. And people who live at the equator have a much lower incidence of that condition. And the further away you get from the equator, the higher the incidence goes. And so something clicked in my brain and I said, this is a sunlight deficiency problem. And I had been avoiding the sun my entire life because Western medicine says so. Number one, it's going to cause cancer, quote unquote, right? And then, preaching this to people that I know and love. And then I decided I was wrong. After I started studying about all the different effects that different wavelengths of light and full spectrum sunlight has on our physiology, it opened my eyes to a whole new world of ways to get healthy. And I started sitting in the sun on purpose, without sunscreen, without sunglasses, for the first time in my life. And within a month, all of my nervous system conditions were gone. My symptoms were gone. I had lost weight. I had more energy. My mood was better. I was sleeping better. And then I decided, I have to tell people about this. And then I found Dr. Jack Cruz, and, he has taught me probably more than anybody in this space, but I learned more about structured water, about magnetism, about mitochondria, and all of these different factors that really constitute our most foundational health. Yeah, and I try my very best to convey at least some of these principles to every patient I interact with, because it doesn't take much. Some of these lifestyle changes are so simple and create such incredible long-term and short-term benefits.
Yeah, I think that's the most surprising aspect of this line of thinking is how simple the changes are with such profound results. And so let's go a little bit into the endocrinology and lay out some of the most common types of things that you see in practice, and then we'll go into a little more how we would apply some of these more they make perfect sense to me, but they seem crazy to other people, right? And we'll get into that. So what's kind of the most common things that you're going to be treating people for?
Excuse me. So endocrinology is the study of hormones effectively. And by and large, the most common thing that I take care of is type 2 diabetes, mainly because of the prevalence, right? There are so many people in the United States that have type 2 diabetes and prediabetes. And then I see type 1 diabetes, which is an insulin deficiency problem. I see a lot of thyroid conditions, adrenal diseases, pituitary diseases. I treat people with obesity, and then reproductive disorders. And that's probably the vast majority of conditions that I cover in office.
So how much of that do you contribute to metabolic disease, right? I guess probably all, but type 1 diabetes, are more related to, say, lifestyle or food? How do you break that down? Just kind of, how Jack will really prioritize light over food, right? He really wants to minimize the aspect of food. To me, I think that it's a much easier first step for people is food. But anyways, how do you view that? How do you view this light aspect versus the food, and how do you approach that with your patients?
So it definitely depends on the condition, right? But I I kind of agree with Jack in that our light environment is paramount when it comes to establishing health. Because, from the story I just told you about me, I was doing everything right from a food standpoint, but my light environment was crap. And I could not get healthy until I fixed my light environment. And I've been able to be a lot more flexible about my diet and I'm talking about an autoimmune condition potentially, right? That was my main issue, and it's different based on the etiology of whatever you're dealing with. In type 2 diabetes, it's definitely a multifactorial condition. Okay, we have a preponderance of highly processed garbage food that the average American eats multiple times a day. And then we also have garbage light that Americans sit under and stare at all day long. And I really think about food being a light code anyway, right? Because every bit of energy that comes onto this planet comes from the sun. All energy comes from the sun. And the plants take sun energy and convert it into mass. So when the animals eat plants, they're eating solar energy. We're eating light in the form of mass. So food can be enveloped in this whole umbrella of the light story. And whenever I am talking to someone who has significant metabolic dysfunction, they really have to work on both food and light to ever reverse that. So, I do a lot of nutrition coaching with patients who have profound insulin resistance, because often whenever that insulin resistance gets to a certain threshold, it takes some pretty aggressive dietary changes to make an impact on those numbers, especially if a patient is not actively trying to strength train and build muscle and working on stress reduction and working on their sleep and so many other things that cause insulin resistance. So, 93% of Americans have some kind of metabolic dysfunction. So I see people who have metabolic disease at the root of their issue. I see other people who have autoimmune disease at the root of their issue. And, but I really think that working on these principles of optimizing diet, optimizing light, optimizing sleep, help essentially every medical condition that exists. So there's a common framework of recommendations that I can give every patient that I know will make them feel better. Regardless of the symptoms they have.
I think that's kind of the most eye-opening aspect of all of it, is like that foundation is pretty much the same for everybody. And it just kind of disease manifests in just a little different, way, but it's like that foundation's the foundation. So let's go a little bit into the diabetes aspect more with light, because when I say that blue light will raise somebody's blood sugar, they look at me like I've lost my mind. Or red light can lower blood sugar. And they're like, what? So you are so uniquely qualified in this world by being able to utilize pharmaceuticals and lifestyle and be a part of everything, right? You actually treat. Everybody else has to say, we don't treat anybody, but you do treat patients. So can you go into that explanation on light affecting blood sugar, especially with diabetes?
Yeah. So humans need full spectrum sunlight, right? And at any given time of the day, 50%-ish of the light that comes from the sun is red and infrared light. And that particular wavelength of light is highly therapeutic to human physiology, and it does many beneficial things in the body. And when we experience blue light in nature, it's always in the context of red and infrared along with it. So they each have individual effects on blood sugar and insulin levels, and they almost are opposite in a way. So whenever we get sunlight outside, it's more likely to have a positive effect on our blood sugar because of the preponderance of red light that's in the atmosphere. And there have been some studies that show that when you take healthy volunteers and you put glucose into their bloodstream, right, with an IV, monitor the blood sugar as it changes over time, when red light is shining on those patients versus blue light, the blue light blood sugars are 27% higher. And that is an enormous increase in blood sugar. And I think many medicines can't do that, right? It's a really impactful change. And the scientists that are studying this propose that this lowering of blood sugar happens because that particular wavelength of light, red and infrared light, will increase the ATP production in a mitochondria, and that process takes energy, right? So it takes available glucose and then it turns it into cellular energy. The pathway by which isolated blue light raises blood sugar has to do with a pluripotent hormone that's made in the brain called POMC, pro-opiomelanocortin, right? And that hormone is cleaved into several different other hormones. It happens in response to blue light from the sun also, but like I said, we have the red effects to temper the rise in insulin and blood sugar that happens. But blue light in isolation raises cortisol through an increase in its precursor stimulatory hormone ACTH. So cortisol is our stress hormone, right? It's our hormone of wakefulness and action. And we all have to have cortisol to survive. And when it's really secreted in a regulated pattern, it's very circadian driven. So we have this natural peak in cortisol in the early morning that really coincides approximately with sunrise, which is designed to pull us out of sleep and wake us up. And that's very beneficial. And whenever we get sunlight first thing in the morning, it really helps to augment that curve and make us more alert. We are supposed to have cortisol elevations during the day to some degree because it helps us stay awake and helps us stay in action. But when we are living under this isolated blue light signal, which would be what we would get from our standard LED indoor lighting and fluorescent lighting, and then, LED backlit screens like our computers and cell phones that we stare at all day, that causes cortisol to be dysregulated and increases cortisol secretion. Well, that definitely has an impact on the nervous system, right? It can, and many people who know nothing about light just know this intuitively, that when they are in bright lit artificial light spaces, that they feel kind of anxious and ill at ease, right? They just don't feel good in those kind of spaces. It can cause headaches, and eye strain, and even when you're not talking about the, hormone secretion and what it does to you at that level. But whenever we have this constant stimulation of cortisol and this other hormone called CLIP that is an insulin secretagogue, meaning that it causes the pancreas to make insulin, then you have this situation where you have elevated insulin and elevated glucose all day long, every day. And over time, that can cause insulin resistance because our bodies really need these periods of relatively low insulin and, fat metabolism, especially overnight, to maintain optimal health and insulin sensitivity. And that goes away whenever we have this constant artificial signal going in our eyes and hitting our skin all day long. So I really think that, part of this big worsening, this big surge in metabolic disease that we've seen over the past 15 to 20 years is due to the changes in our light environment and, the non-native electromagnetic fields that we interface with. It's not just the diet. So we have a lot of work to do as a society to help protect people against these changes. But I see patients all the time who come in to see me who have like horrible diabetes control, and they're doing everything that they can to avoid processed food. But for instance, they may be a shift worker, and so they're not sleeping at the right time of day. They have the worst form of circadian rhythm disruption, and that completely wrecks hormonal health and wrecks metabolism. And I've told many people over the past few years that they're not going to get better until they're able to sleep at night. And I think that's true.
That's absolute fact. I spent many years working on an ambulance, and 24-hour shifts about killed me. Like I was, low testosterone in my early 20s. It was insane. So I want to shift just a little bit into the thyroid, because just about everybody I talk to either thinks or has been told they have a thyroid issue, right? And based off of what you just said, how many endocrinologists or doctors understand that light has that big of an impact, do you think, before we get into thyroid?
Not many. Okay.
That's the scary part.
Yes. I'm a part of, these Facebook networks of endocrinologists all over the world, all over the country. And I can see, this hole in their knowledge very, very frequently. And whenever I interject in those spaces and say, hey, look at this study about light, it's crickets. Like nobody engages with me over these things. And I just don't feel like most practitioners are curious about why our health is declining in the United States, right? So what happens is with our insurance and RVU payment model for doctors, we get guidelines from governing organizations that are based on research studies and science, quote unquote, science, right? So leaders in the field will say, for instance, we recommend that every patient with type 2 diabetes over the age of 45 is prescribed a statin drug, right? And then that becomes a benchmark that by which practitioners are graded. And if you don't check the boxes, you may not get reimbursed for that patient's care. So it gets really complicated, right? In these 15-minute visits that most providers are allotted to make sure that you check all these boxes. And so there is no time in the average appointment to discuss diet, sleep, light exposure, stress, any of these things. You're just trying to make sure that the guidelines are met for that patient. And a lot of doctors are stuck in jobs that require them to crank patients through like a factory, okay, and want to do better. They do want to do better, but they don't have the latitude. And this is what happens when big healthcare systems buy out medical practices and then are siphoning profits from all of these doctors, and they require the doctors to meet a certain production threshold. And if they don't, they get fired or they don't get a bonus or whatever, So a lot of practitioners exist in this space of complete burnout where they're just showing up to get a paycheck. And that's not what anybody goes to medical school to do. But it's just reflective of our broken system in medicine. And I really believe that in the near future that whole framework is going to change, because we just have too much dissatisfaction between doctors and patients that exist in that paradigm,
Yeah. Mm-hmm. The whole decentralized healthcare is a big deal. So let's go about into the thyroid decentralized approach. What do you think is well, for one, do we really have a thyroid epidemic, right? And if so, what do you feel like is that biggest contributor? And then I want to go into kind of a little bit more of the controversy around thyroid and iodine and minerals and all that. And I want to get your take on it and how you view that. So do we have a thyroid epidemic? And if so, why?
Well, primarily in the United States, thyroid disease is constituted largely by autoimmune conditions, right? So we have Hashimoto's thyroiditis. That's the most common cause of hypothyroidism in this country. Worldwide, it would be iodine deficiency, right? Because the thyroid uses iodine to make thyroid hormone. If you're in a landlocked country and you don't have any iodine, then, people walk around with these huge goiters. That's not the United States. United States, largely, we're dealing with autoimmune issues that cause thyroid disease. We also have thyroid nodules, thyroid cancer that probably doesn't have an autoimmune link, but far and away, most of the thyroid patients that I see are Hashimoto's patients who have hypothyroidism. And that definitely is increasing in recent years, the incidence. And most autoimmune diseases are, though. And but the typical patient that I see on new evaluation who is self-referred, it's a middle-aged female who is tired all the time, cold, losing her hair, can't lose weight, and says, I must have a thyroid issue and wants to be evaluated for that. And usually those patients don't have an overt thyroid issue, but they do have a metabolic problem. And interestingly, there are disorders of metabolism like leptin resistance, okay, that we could talk about more if you want to, but cause a functional type of hypothyroidism in that the body is down-regulating the metabolism to accommodate for a perceived low energy state. Anyway, autoimmune disease in this country, like I said, is getting more and more common all the time. And we don't really know precisely why that is, but there are lots of guesses. Environmental toxin exposure and circadian disruption and metabolic dysfunction all contribute. Chronic stress, living in this sympathetic overdrive, there's a definite relationship. I see that in particular with patients who have Graves' disease or autoimmune activation, stimulation of the thyroid. Diagnosis, at least half the time, I can tie that to a period where that person was under some intense stress. Either they lost a loved one or they lost a job or something of that nature. So I know that chronic nervous system activation, just like not having enough rest and repair, makes a big difference when it comes to the etiology of these conditions.
So two aspects I wanted us to get into, kind of like the David Brownstein kind of theory. Just curious on your thoughts with that, and then go into kind of the bromine, fluorine, fluoride, but also Jack's approach of that, Jack Cruz, with the sunlight and the T cells, thymus, melanin, bone marrow, right? Like I think that's an aspect of the whole autoimmune catastrophe that we're facing. But do you approach thyroid with minerals or in detoxing? Is that something that is worth focusing on, having any sort of a protocol around, or is that really kind of dangerous? Because you hear a lot of, hey, don't overdo the iodine, it's going to cause thyroid issues, whereas you have somebody like Brownstein or Abraham Guy that they have done, or Guy Abraham, a lot of using extremely high doses of iodine, and they're helping people. So there's just kind of a lot of confliction there. Mm-hmm. And I just, wanted your perception of that.
So in general, I don't believe that, hypothyroidism from an autoimmune in an autoimmune container is caused by low dietary iodine. And we know that thyroid hormone is made from iodine, and that fluoride is toxic to the thyroid gland. And I don't know David Brownstein, so maybe I can read about those protocols later on and get back to you on that. But, we use SSKI, saturated iodine, to treat overt hyperthyroidism and thyroid storm in the hospital, because in the short term, large concentrations of iodine in an overactive thyroid will actually turn off thyroid hormone production. That effect is temporary, and so over a couple of days, it wears off, but iodine can have really interesting effects on thyroid function. I don't think that it's dangerous for a majority of people to supplement iodine, but I have seen patients who have autoimmune hyperactivity of the thyroid gland, hyperthyroidism, become more hyperthyroid when they've gotten iodine from, say, CT contrast or some other large bolus of iodine that wasn't even intentionally given or taken by the patient. So I'm pretty cautious with using iodine in my own clinical practice because I have seen it hurt people. But we have a lot to learn in all of these spaces. And so I think it's important to listen to practitioners who are having differing results so that we can learn more from each other, right?
Yeah, absolutely.
So overt detox programs, I do have some experience with. It's not what I ever reach for first in someone who has Hashimoto's, for instance. But I do think that it can be helpful, especially if a person's primary detox pathways are not open and being utilized. But when I think about detox in the body, I think about liver health and kidney health, right? And so if the liver is able to metabolize a lot of toxins and the kidneys are able to excrete, and a person is intentionally sweating regularly, optimally hydrating and replacing minerals, then that may be all that they need. Optimize bowel movements, optimize kidney function, and then sweat. And that may be all that a person needs to detox. You may not need binders and parasite cleanses and all these other things. So I like to start with the basics, with working on hydration and minerals and sleep and sun exposure, and cleaning up the diet, usually trying a period of, gluten-free diet too. So that has been, I've seen that anecdotally help thyroid patients, and see where that gets us as far as disease progression or symptoms. I also do a lot of work around light and thyroid health, because there have been studies that show that photobiomodulation or red light therapy on the thyroid can decrease thyroid inflammation, which Hashimoto's is caused by thyroid inflammation. So I have many patients on red light therapy protocols, and have seen some pretty significant improvements in antibody reduction with those.
Really cool. So you being in Tennessee, me being in Arkansas, we got a pretty similar, sun environment. Where is your focus on trying to get somebody to get a tan and melanin renovation? And is this something that you see as being a really important factor, or not so much? Just kind of curious on that, which goes back into, Jack's autoimmune way of seeing it.
It's 100% important, right? Having melanin is like a superpower. It's so important. And, just talking about fluoride and melanin's ability to scavenge heavy metals as a semiconductor, it's powerful. I will tell you that it's a very hard sell for me. Like for whatever reason, probably because the American Academy of Dermatology tells everyone there's no healthy tan. Okay. And this is like the propaganda that we're up against, that nobody that comes into my office in my centralized practice, okay, is expecting me to say that you need to get a tan this summer. And when I do, I hear, I burn so easily. I'm allergic to the sun. I have a history of skin cancer. My dad died of melanoma. You know, like every excuse that they can give me, because I think the vast majority of people, until they get hooked on the sun, don't enjoy sitting in the heat, sitting in the sun. And this is what I work on, you know, every visit as I'm seeing these people several times a year, to try to encourage these little habits that eventually the results speak for themselves, and I don't have to do any convincing, right? But we need melanin to make energy in the body from sunlight. We use melanin to split water into molecular hydrogen, free electrons, and oxygen, right? Like it's the way that our body can utilize sunlight directly for health and vitality. And every person, I truly believe, maybe with the exception of, you know, somebody with true albinism, every person can get a tan, and it might not look dark and robust, but, you know, I know plenty of Irish descendant mitochondriacs who have, like, they freckle and tan, right? Freckles are melanin too. So I really think that they probably provide their own benefit, right? Yeah.
I'm with you. It has been a hard sell, but I have spent many years in and around the medical industry, right? Being on an ambulance for as long as I was, the amount of times that we worked with hospice and just chronic diseases, it was literally every single day. But there is absolutely a skin tone correlation, and the melanin is a big deal. And so everything, you know, I kind of come from this cancer lens, but it's everything. And so, like, I make my kids sunbathe, right? I go try to take sun breaks and get out. We have, you know, you've been to the market. It's an outdoor farmer's market. I'm out in the sun all the time, unless I'm in a studio or working on the computer. But having these sun breaks and building a tan has been such a focus for us this year, right? You know, Jack Cruz completely changed my life. Like the good, the bad, all of it. Just he did when he made me focus on the melanin. And so, do you feel like that is something that we can fundamentally create a plan around on this decentralized health protocol as a core tenet? Like, let's get a tan and get away from the paradigm that we're having all these problems caused by the sun. But if you get a tan, so much of these things go away, because it seems that way to me.
Yeah, I know. I agree. And, you know, my family's the same way. We seek the sun like crazy. And every single chance I get to go outside and sit in the sunshine, I do. And I work in an office most of the week and under horrible lighting. And I start the day in the sun. I eat lunch in the sun, and I end the day in the sun. And sometimes that's the best you can do in daily life. But it doesn't take very long to build a solar callus. And I'm sure you've talked probably about this on your podcast before, but when I started sitting in the sun, like, I had never done that my entire life. I think I wrote a paper when I was about 16 years old in high school, research paper on the dangers of UV light from tanning beds. Okay. So I was like, from an early age, not getting the sunshine. And so I burned in about 2 minutes of being in high UVI, right? And thought that I burned easily, that was just inherent to my body and my physiology, but that's not true. Like, it took just a few weeks of me sitting for 10 to 15 minutes in mild intensity sun to be able to tolerate high intensity sun and not burn. And I think I'm probably Fitzpatrick type 2 or 3. I'm not sure, skin type. And since I learned all about this, I've been to the beach about 5 or 6 times, have not worn sunscreen, and have not burned, right? I think that it's really important to be smart about sun exposure and not overexpose purposefully, because, I mean, the sun is powerful. It's the source of all energy on the planet, and it definitely can hurt us if we overexpose chronically, right? But every human needs a certain amount of full spectrum sunlight a day, and we all need to have solar calluses. We all need to have tans if we're able to get them for optimal health. And tans are protective. So, like, that allows us to capture more UV energy, which is very powerful for our health. Like, when we can stay in the sun longer, and we have more melanin to capture that energy, it's a major source of healing for humans. Absolutely. Yeah.
So are you able to do telemedicine? Are you able to help people? Because I get asked almost on a daily basis for a recommendation for an endocrinologist, like seriously. And so, like, there's just, like we talked about earlier, we're missing such a fundamental piece in medicine anyways, that I feel like the need is there. So is that something that's an option? Is there a functional endocrinologist type option for people to get with?
So, I work in Tennessee, and I have a Tennessee medical license. So that restricts me to see patients in the state of Tennessee. But, if you have enough, Logan, you got enough patients sitting in my way, I'll get an Arkansas license too.
There we go. All right. Just start working on it then. Get ready. Get ready. All right. Well, thank you. Excited about the group. I think there's so many of us in the network working to bring it together, and we've got just brilliant people that are trying really hard to bring it together. So it's definitely exciting, to say the least.
Oh, yeah, I agree with you. Since dipping my toe into this space, I cannot believe the connections and the support that's just fallen into my lap, right? I know that this decentralized approach, this vitalism approach, quantum health, this is the future of healthcare, and we are on the front edge of this wave. And so we just have to keep showing up for each other and learning and teaching, and hopefully we can give people the tools to really take care of themselves and capture their own health and be their own healers, because it's very, very possible. And I would love to be not needed anymore, right? Like if I never had to see another patient with type 2 diabetes again, that would make me thrilled. So I hope we're headed that way.
I love it. Well, thank you, my friend. It's a pleasure getting together. Let us know where we can go and follow along with what you're doing, your work. And then, again, thank you.
So I am slightly active on Instagram at Kelsey Dexter, MD. I try to do better, but I'm a single mom of 2 little kids, and I have priorities. But I'm pretty accessible there. I have a school group called Circadian Health Revival, and so there are quite a few of us now. But another practitioner, Heather Peterson, and we teach about these quantum and circadian principles, and we lead group challenges and things every few months, and so that's really fun. And then, of course, if anyone's in Tennessee and wants to connect, they can shoot me an email, and I'll be happy to get in touch if you need a practitioner relationship or would like that. So, but I'm very, very honored to be here, and thank you, Logan. I appreciate the chat, and happy to have the connection.
Thank you, my friend. Thank you for joining us in the Sowing Prosperity mission. If you like this content, like and subscribe, share with your friends. Be sure to check out sowingprosperity.com. Sign up for the email. We've got so much more work to do.